This is the first video on constipation and will discuss the causes of constipation. Constipation occurs when a person has difficulty in emptying the large bowel or colon. Some will describe hard stools, others share that opening their bowels is too difficult or too infrequent. Some will strain to pass stools, and others feel as though they cannot empty the rectum. By definition, constipation is said to occur when a person opens their bowels less than 3 times per week. Constipation is said to be chronic if it lasts for longer than 3 months. It is estimated that 12% of the world's population suffers from constipation. What are the causes of constipation? Age. Constipation increases with age because colon movement slows down with age, and also older people tend to be less active. Gender. Women, especially when pregnant, tend to be constipated because of changes in hormones which makes them prone to constipation. Also, generally, women tend to be constipated more often than men. Low fiber diet. Most people consume inadequate fiber in their diet. The recommended daily fiber intake is 25 to 30 grams. Lack of fluid intake is another cause. Many people do not drink enough fluids. Recommendation is to drink at least 2 liters of fluids, including water, in a day. Lack of exercise, particularly when people become less active with age. Regular exercise helps in bowel movement. It is recommended that people exercise at least 30 minutes per day and a total of 150 minutes in a week. Irritable bowel syndrome, which is a functional disorder of the colon. In irritable bowel syndrome, constipation always occurs with stomach pain. The condition is commoner in women and younger people. I have discussed irritable bowel syndrome in great detail in a series of videos. Please visit these videos if you want to learn more about the irritable bowel syndrome. Another common cause is a condition called chronic idiopathic constipation. It is a very common cause of constipation and affects women more than men. It can occur at any age. It is estimated that about 14% of the population suffer from this condition. The majority have slow colon transit time, although some have normal transit time. Transit time is the time taken for food to travel from the stomach to the anus. There is usually a failure to relax the muscles of the anus and rectum during defecation. Unlike the irritable bowel syndrome, patients with functional constipation have little or no abdominal pain with bowel movement. They also rarely have diarrhea. Unlike irritable bowel syndrome, the symptoms in chronic idiopathic constipation do not improve after defecation. As the name idiopathic implies, there is no known cause for this condition. All investigations are normal. Another common cause is called dyssynergic defecation. This condition is due to a lack of coordination between the various muscles of the rectum, abdomen, and pelvic floor. The normal process of defecation begins by the various muscles of the rectum, pelvic floor, and abdomen increasing pressure inside the rectum, followed by relaxation of the anal sphincter. This condition results where there is a lack of coordination between the various muscle groups, including the anal sphincter. It is estimated that nearly 30% of patients with chronic constipation suffer from dyssynergic defecation. It can begin at any age. The common symptoms are constipation with straining, incomplete bowel evacuation, hard stools, and the use of fingers to get the stools out. Often, fiber supplements and laxatives don't relieve symptoms. There are effective ways of managing dyssynergic defecation, which I will discuss later. Drugs and vitamins can also cause constipation. There is a long list of drugs that can cause constipation, as has been listed here. Stress, including anxiety, depression, and post-traumatic stress disorder, can cause constipation. Hormonal disorders can also cause constipation. These include type 2 diabetes mellitus, hypothyroidism, where the thyroid gland does not produce enough hormones, and a rare condition called hyperparathyroidism, when the blood levels of calcium are high. Pregnancy can also cause constipation. The main reason is that in pregnancy, more of a hormone called progesterone is produced. This hormone relaxes the muscles of the intestine. When this happens, the movement of the intestine slows down, and this results in constipation. Painful anal conditions like a tiny tear in the skin around the anus called anal fissure and swollen veins in the anus called hemorrhoids that have clotted can also cause constipation. Then, damage to nerves around the colon and rectum which slow down the movement of the colon. This happens in conditions like Parkinson's disease, stroke, and long-standing diabetes. Finally, there are more serious conditions which can cause constipation, like obstruction or blockage of the colon. This serious condition can happen in cancer in the colon or rectum. So these are many of the causes of chronic constipation.